Yeah, for those, I don't think I introduced myself, but I'm Brenda Eap. I am the VP of Communications and Partnerships at the Alliance for Longevity Initiatives, and I hope you guys are having a blast so far. Okay, so up here we have, these investors will not be giving out money, but they will be giving advice and insights, at least for the time being. But let's start with a brief intro because we don't have much time. So, Karl, if you want to start off.
I'm Karl Pfleger. I'm an investor, obviously, and I also run agingbiotech.info, which is a one-stop shop for trying to link to and summarize everything important in the field, in the biotech portion of the field between academia and the clinic, including a long list of companies.
Hi, I'm Alexandra. I'm with Apollo Health Ventures. Those who were here heard all about what we're doing. Briefly about myself, I'm originally a scientist by training, started working on aging over 15 years ago at Harvard Medical School, but then turned towards the business side, went into management consulting with the Boston Consulting Group, and then in 2017 we started investing with Apollo, one of the early investors in the space.
Hi, I'm Petr Sramek, managing partner of Longevity Tech Fund. We invest in early stage longevity biotech companies and diagnostic companies. We have more than 40 companies in our portfolio, and I'm actually happy to see at least 6 of them sitting in this room.
Great. We saw a lot of companies, and they were all very different, right? Can you agree? Yeah, that was really good, actually. Let's start with you again, Karl. But what excited you the most about the companies you saw today? Anything stand out?
2 things stood out. One was that there seems to be interest, which is interesting and good, right? So, for example, Intervene Immune has a lot of interest after their results from the first trial, a lot of interest in joining the bigger expanded trial. That's great. And NeuroAge seems to be seeing a lot of interest in their tests, and that's great. So I think the interest stood out. Of course, the big problem in the field is that the majority of the public doesn't even know we exist as a field and that you can interfere with aging. And the main thing that brings us all here is that needs to change, and the lawmakers need to help resource things appropriately when it does. And so the other thing that stood out to me, and I know Chris knows this, although I don't think he emphasized it in the talk, but presbyopia is really common, and so the promise of something that could fix that, could really be transformative in terms of how many people understand that aging can be fixed, and so that stood out to me.
Before we move on, I want to thank you for doing your part too, for making agingbiotech.info, and that's just a spreadsheet of information that people can easily access to. So, yeah, Alex.
Well, I liked the selection of the companies because they were so diverse. Like all of them were doing something very different, and a lot of them actually were going more towards the consumer side, or maybe initially towards the consumer side, which also speaks for the fact that there is a lot of interest in the space right now, but also makes it, in some ways, at least if it's targeted towards the consumers, less accessible if you wanted to make it available through a traditional healthcare system. Maybe something to note, but maybe we can talk more about that later. But yeah, what I really liked is that it was so diverse.
Great. Petr?
Yeah, 2 of them are actually our portfolio companies, so Intervene Immune and Yuva Biosciences, obviously I like them. And we have a cooperation with Dobry, so definitely that's something very, very important, and we see a big role for plasmapheresis or therapeutic plasma exchange in a clinical practice. Even we have one clinical platform where we cooperate with them and do TP regularly. I like LentoBio. I agree with Karl that that's something like unmet need, right? Everyone is very careful about his eyes, and for me personally, it's one of the major priorities, because I can't imagine living without proper eyesight. So LentoBio, I would say, it's the really the good one.
Yeah, well, let's keep it there, Petr. Are there usually, I'm pretty sure you've seen many, many decks in your lifetime now. Are there areas that you usually like to see founders emphasize when they're giving their pitch?
Yeah, so, well, that's, first of all, our investment thesis is built on, let's say, comprehensive coverage of, I don't like saying aging hallmarks, but, the aging field. So we'd like to see solution for every part of our biology in various stages. I mean, like something what we can do very early or something we can do in more dramatic way later. So this is the basic of our strategy. Obviously, we don't have everything yet. So what we are looking for are these missing pieces. And there are some like solution for eyes or generally extracellular matrix. That's something which is not really covered yet. And there are some approaches which sometimes comes like from blue sky, completely novel. So we like to look at this too.
Yeah, what made you or Apollo Health invest in the ones that you've listed during your presentation?
Oh, we actually haven't invested.
Oh, you haven't. Never mind. But so, what are some areas of like the pitch that you'd like to see or emphasize?
Yeah. So those who were at the presentation probably saw that. But as I mentioned, what we pay a lot of attention to early on is initially the science and the conviction that we get from the data that this can really make an impact on human health. For instance, if there's only data in some aspects of or certain animal models, but not others. It's really about having a lot of different aspects of conviction that gets us to invest in a startup, or at least initially dive into the strategy more. But then besides the science, I think I mentioned that as well, is how do you actually execute on that science? What's your strategy to bringing it into the clinic? Is that something that will be able to return an investment to the investor in a reasonable time frame? And also, once this is approved, will it be? What's the likelihood that it will be really accessible to the broad population rather than just a very few? Given the pricing of it. So I think those are the things that we really like to pay attention to.
Yeah. Karl, I know you specifically invest in rejuvenation companies, right? So
Yes.
So what makes all the company pitches you've seen so far that are in that space, and why do you invest in the ones you do?
I mean, I normally mostly just look at, the mechanism of action. That's the main thing that I care about, and the other question is why now? Like, what just happened? What was the breakthrough that caused this to be the right time for this to be translated and moved into a company in order to get it to clinic and get it to people? Those are the sort of things I want to see in a pitch, and to help me decide whether or not it really is rejuvenative versus just age slowing.
Okay, that makes sense. And I know there was a lot of talk about, grassroots advocacy, regulatory challenges too. I don't want to just throw it out there to everyone, to the three of you. Like, what do you think are some regulatory or market hurdles that, the field currently faces?
This is something that was talked about a little bit before, the need for markers, and we saw some presentations that were showing measurements of certain endpoints, certain ages. What we really need in the industry is a common established marker that we all not just believe in, but there's solid evidence that this really means something. Because right now people are using different types of clocks. Some say some point into one direction, some point in another direction. So what we really need is to unify this into the actual ground truth of, are you really making an impact on human health? And based on that, we can then validate these interventions to really see whether they are indeed rejuvenating and making people healthier. So and once we have that, I think the rest of the industry will follow and make these therapies more accessible because the evidence is there.
Petr, did you want to add anything?
Yeah, so, well, I think that obviously on top of all of that, we have been talking about, I believe we need to see some like a new generation of new commercialization pathways, right? Because as investors or anyone, we want to see how this will eventually, go to the market and generate, return of investment. On the other side, it will, be much more accessible to everyone. And I don't think that for longevity therapeutics, the current pathways, like through typically big pharma, are the right ones, right? So that's something I think that we need to see to come.
So I'll just add that, I think that the current pathway is workable. It's just slower than it should be. But without any regulatory change, we'll get these companies are targeting core aspects of aging. Those core aspects of aging in geroscience paradigm style should underlie multiple diseases. So they could pick from multiple diseases to go to market. They pick one because they have to under the current framework. But after getting approval for that one, then they can label expand, or doctors can prescribe off-label, and so they can get the multiple pots of gold, which is sort of the promise of the geroscience paradigm. And that can all happen under the current regulatory framework. It's just not optimal for this field for that. But it can. And so one of the things that we should all be aware of is that the fact that the lawmakers don't understand the geroscience paradigm means sometimes there are some risks. And part of the team at A4LI is working on this, but there's been some regulatory issues with some penalties for getting approvals for multiple indications, and so I won't go into the details on that, but the idea that laws would ever come into play that would actually penalize getting approvals for multiple things by having less long pricing power or something like that is obviously terrible from a societal point of view. So that's sort of this field-wide systemic risk.
No, that's good. And for those who don't know, but A4LI has written an advanced approval pathway for longevity medicine. It's on our website, so take a read. But that's one of the plans we have in the works in terms of advocacy. So back to the pitches, though, we saw a lot of direct-to-consumer, right, products or that kind of pipeline. What would your best advice to them be? Like hire a really great marketing team like Brian Johnson has, or do something different? How do we help these startups and navigate the market and make sure it gets to everyone at a reasonable fashion? I don't know if that made sense.
Yeah, so, well, the consumer market is not easy. It's obviously a completely different market than, the market around in the traditional medical drug space. What we see that the market is definitely not ready yet for, let's say, fast uptake of any longevity therapeutics or like novel methods or novel form of supplements or solutions. There is a market, definitely, but it's not as big as everyone is talking about, because if you look at some public articles or newspapers, it looks like billions are flowing everywhere. That's not true. Companies are not yet thriving. So everyone needs to be ready for like a long run before we can see. We will definitely see this big uptake, but it may take another 5 years maybe.
I really like that some of actually a lot of the consumer-facing companies that we saw are doing proper scientific work. They're actually doing studies where you demonstrate that they actually work. The only challenge that most of these companies will be facing is as soon as the next player comes around and has a stronger marketing team, they might get a lot of their business, even though your product may actually be better. So that's the reason why we don't do a lot of investments in a consumer space, because it's really marketing driven, and if you have good science, you might actually be more successful in the long run if you do the proper development path through the regulatory pathway. But on the other hand, of course, if you have something really good, you also want to bring it to the population as quickly as possible, and that's the way you can do that with the consumer path. So I understand that it's just maybe not as scalable or sustainable.
In some ways, the question really has different answers depending on what category of direct-to-consumer you're talking about. So if it's diagnostics that are direct-to-consumer, then the answer is different than if it's therapeutics. So for example, the NeuroAge diagnostic stuff that's direct-to-consumer, all you need to do is, you need to dig up the articles that prove that there's something you can do about it, and therefore the diagnostics have some. So the Ornish study showing reversal is great, because then now I can take these tests and I know what I'm going to do depending on what the result is. If you're a therapeutic company, then there's two subcategories. Your thing really doesn't work, or your thing does work. And if it doesn't work, you hire the marketing. And if it does work, you still hire the marketing. But then you also have this other option, which is, go find the right test that really actually, if your thing works, but really it's such a small thing that it only helps 20 years later, then you're just stuck in the marketing world again. But if your thing actually helps in a way that in a short amount of time you can actually detect somehow, if it really does work, then maybe we don't have the right tests and we need to wait until we develop them. But there are a lot of tests, and there's a lot of disparaging the clocks, but there's other kinds of tests, and there's functional tests. So the trick is to find the test that really actually shows it, and that's how you can really, in addition to doing all the proper clinical trials.
And you've been really transparent with all the tests you've done, and comparing them to. So thank you for that. By the way, I just noticed you all have the same Aura ring.
Garmin.
Garmin, everything. That's good. All right, so we're running out of time, and we really do want to close it off and for people to mingle.
You don't have your,
I don't. I have a whoop. Maybe I should get one. So for folks who are thinking about investing, they're ready to come into this space and deploy their capital into this field. What are some words of encouragement? And do you have anything to share?
Well, so this can't be emphasized enough, especially for the rich old people, is that the worst thing that can happen after you retire is that you outlive your money. And so the great thing about investing in this field is that it is aligned with that risk. So if you invest in the longevity companies that are going to bring things to market that are going to keep you alive for longer, then you'll have the money from the investments to keep funding your retirement. And if the field doesn't work and you die, then it's okay that you didn't get any return on those. Very aligned. So as a result, not only for the people, it's for the pension funds, it's very aligned, right?
I'm very hopeful that we are living in a very special time right now where the whole progress on developing longevity therapies is really accelerating, and hopefully new pathways are opening up very soon, and also the tools that we need to open up these pathways are opening up very soon, so that an investment in that space will be much more lucrative in the short term, and we need the investment because it goes hand in hand. With more investment, we can actually accelerate, and everyone's going to benefit from that.
I think what's encouraging is that it's actually working, right? So we see this in our clinical platform that we can really do a lot for individuals. And what we all need as a field is to make this public. We need more user case studies, about real people, not just Brian Johnson, right? But normal people who get much better, and we need to display that as a field, right? Because that's something what sells, which will create demand, and that's the main driver of the everything for the future.
So there's actually 4 good answers to this, but since there's only 3 of us, I'll go again. So the thing about the geroscience paradigm is that it attacks the things that underlie multiple age-related diseases. So the normal startup investing, tiny chance of a pot of gold is actually redone in aging biotech and longevity biotech specifically. It's actually same small chance for the first indication, but then you get multiple pots of gold. So it's actually, there's good reason to believe it should be more lucrative than normal biotech, prior biotech investing.
Well, this was great. Do we have any questions from the audience? Thomas, I think.
Thank you. So Brenda, you mentioned that A4LI has a regulatory pathway proposal, the AAP11, and Eric, I think, also mentioned our Catalyst Institute's Thrive Act proposal. So here's a panel of investors here. Are you for it, or one or the other, or how much difference does it make in terms of how you invest? As you're talking about the need for regulatory pathways, so what are you guys trying to do? What are you looking for? Which, if you get it, you're going to invest differently.
Well, I think right now a lot of us investors are investing in the stepping stone strategy of looking for a very specific disease where we can make an impact, even though the science is there that we would have a much broader impact on health. But we have to go through that strategy to get approval, and we base our business or investment case on that one indication initially. Obviously, we have this additional upside, but then if the pathways would enable us to do that faster and do that more broadly towards really looking at an effect on aging, maybe the strategy would change a little bit away from looking for the stepping stone disease, but rather have something that is much more likely to have a higher impact on overall aging, and that probably would make a bigger impact on health overall.
I tend to invest in platform companies more than single asset companies, and so there, even that stepping stone initial indication isn't as important because there's a whole pipeline of things, and so the regulatory changes, I'm in favor of them because they'll move the whole field faster, but they're not going to make any difference to the individual investment decisions. It's just going to make the whole thing more lucrative.
Yeah, what we are looking for is, to easy this later steps of development and investments in biotech companies, because right now, when companies entering clinical trials or like Series A, B, and is requiring like a large investment tranches, typically traditional biotech companies or VCs come into play. They lock into very narrow part of the longevity potential. It may die for longevity forever. So what we are looking for is that it may open that end for other indications or general aging.
Hey, I know Karl and Peter, of course. I just wanted to ask actually about the FDA regulatory path again. My concern is that we might miss out on some really good therapeutics that are, if we just end up sort of aiming through the FDA regulatory path of the treatment paradigm of diseases. Because some of these medications might actually be preventative, but might not actually work at all in the space of actually treating a disease. As investors, do you share that concern?
Absolutely. I think a lot of the drugs are probably much more potent if we use them preventatively, but we can't do that in a clinical trial because that trial would just take too long. And that's why, again, we really need those markers that can assess, even in a healthy individual, whether you're impacting that health score or whatever you want to call it. And with that evidence, be able to get such a drug approved.
I also want to note that tomorrow we'll have a full day of panels, and we'll have another investors' perspective panel that will take a deeper dive into this. So if you guys are joining tomorrow, please bring your questions there. Dylan is giving me the eye, so I'm going to hand it off to him so he can do closing remarks. But this was really great. Thank you, Karl, Alex, and Petr. And yeah, here we go.